Hi, everyone. I'm Meredith Thompson, coming to you from the University of Florida in Gainesville. And I'm excited to talk to you about our study titled Uncompensated Academic Workload Negatively Correlates with Job Satisfaction Among Emergency Medicine Residency Faculty. In the past several years, there has been increased focus on physician burnout as well as retention of well-qualified emergency medicine physicians. Job satisfaction has been previously demonstrated to be a factor in prevention of physician burnout, correlates with job performance, and has been suggested to be an indicator for healthcare quality. However, this factor has not been specifically studied in academic emergency medicine physicians. Traditionally, careers in academic medicine have been divided into four domains of clinical patient care, education, administration, and research. Previous studies have indicated that an individual's overall burnout level is inversely dependent on whether their time is allotted in each of these domains in a way that the individual desires. In addition, perceptions of uncompensated work have been qualitatively demonstrated to be reasons for attrition of academic faculty of multiple specialties in one single institutional study. Although there has been significant changes in the past 30 years in how overall time is compensated for emergency medicine residency faculty, we hypothesize that a majority of the time spent in non-clinical domains of education, research, and administration continues to be perceived as uncompensated, and that this is a negative predictor of job satisfaction. We constructed a cross-sectional survey that explored known contracted hours for clinical and non-clinical time, divisions of time between domains, and perceived workload. We measured job satisfaction by a previously validated global job satisfaction score. The score ranges from -3 to 3, with a higher score indicating lower job satisfaction. Our survey instrument was piloted to contact experts for clarity. Our survey was distributed in March through April of 2020 to a convenient sample of residency program faculty. We distributed the survey via email to personal contacts at 49 different residency programs who then forwarded the survey to their respective faculty. The survey was distributed to 1,791 academic faculty in total. We allowed for our contacts at each institution to determine who represented academic faculty at their institution. We also requested a response from the contact as to when it was distributed and how many people they sent it out to. If we did not receive a response from this contact, we assumed that the survey was not distributed. If there was a response that was sent, but no response as to how many faculty it was sent to, we then determined faculty members based on their particular residency website. Data was analyzed using a one-way ANOVA test. There were 265 responses, resulting in an estimated response rate of 14.8%. Overall, the gender of respondents was similar to graduating residents in emergency medicine per the most recent ACGME databook. Ethnicity was roughly similar, but underrepresented Latinx faculty compared to graduating residents in emergency medicine. 96% of respondents were full-time faculty and 55% worked at university-based programs. The most significant finding from our survey is that of those who knew what non-clinical time was specified in their contract and perceived that they were working more than specified, had a higher associated global job satisfaction score, meaning they had lower job satisfaction overall compared to peers who had different perceptions. Additionally, only 80% of respondents knew how many clinical hours they were contracted to work, and 40% of respondents stated that non-clinical time was not specified in their contracts. Most respondents perceive that they work more clinical patient care hours than they would like to, and fewer education or research hours than they would like to, which, as mentioned, has been associated with higher burnout in physicians. Limitations of our study include distribution during the early COVID pandemic, largely at a time of the surge in the Northeast. Our choice of surveyed residency programs was a convenient sample and may represent some geographic bias. Additionally, our response rate was lower than hoped, and because we allowed our contacts to respond with the number of surveys distributed and we did not always receive a response, our response rate may be inaccurate. In conclusion, our study found that perception of uncompensated non-clinical workload correlates negatively with job satisfaction. Additionally, academic emergency medicine physicians do not work their ideal breakdown between clinical, education, research, and administrative domains, with prior studies showing that this contributes to physician burnout. Despite the limitations of our study, our findings suggest that increased focus should be placed on non-clinical workload and the compensation thereof to improve overall job satisfaction, enhance wellness, and prevent loss of physicians from academic emergency medicine.